So it's not just about personal freedoms, right? It's about the safety of us as a society. Okay? Now, just because you're not seeing the disease and the death and, the overflowing hospitals across the street from you or in your neighborhood does not mean it's not happening. Okay? Now, all this stuff that's occurring is occurring behind closed doors. Okay? So don't expect to see chaos everywhere, especially with social distancing. Okay? With social distancing, people are staying at home, people are following the rules they're supposed to follow, and guess what? It's working, right? Talk to all the protesters out there who are protesting against the quarantining and social distancing guidelines that we've been using, that have been working to kind of subdue COVID-19. And I understand where people are coming from. They want to exercise their rights and freedom, and they are fed up and frustrated, and they want to get back to normal life, buy the things they want to buy, do the things they want to do. Now, it would be a mistake to simply quickly roll back all of these restrictions that we've been using that have been working and try to get back to normal life to open up the economy, okay? And even if you're in an area where you haven't been hard hit, okay? Now, the reason is because this virus is going to be lingering around for a while. It's not going away anytime soon. Even though in some areas there's been a plateau in the number of cases and deaths, that does not mean that the virus is sort of going away. Okay, all that means is social distancing is working. But if we want to really eliminate this virus from society and keep people as safe as possible, we have to persist and do this in a controlled fashion. So the way to open up the economy is in a controlled way in various phases, okay? We have to keep people safe. First of all, we have to make sure that the number of cases is declining and the true surge in a particular area is on the way down. When that happens, we also have to make sure that we have the ability to test people rapidly. So if somebody does have signs of infection or they're exposed to somebody who did, we should be able to test them rapidly and quarantine them, okay? We also have to have the ability to contact trace. And that means if someone's infected, then we'll be able to track who they were close with, who they interacted with, and subsequently quarantine and test those individuals to also prevent further spread. We also have to have the capability of antibody testing, okay? And that's also becoming more rapidly available. Antibody testing allows us to test people to find out if they have antibodies and see if they're immune. That way we can more safely put those people out into society and be at lower risk for being carriers of the virus or being vectors for transmission for the virus, okay? Now, all these measures are necessary, and we have to do it slowly before we open up the country back to normal. If we do this too rapidly and just simply open up all businesses and get people back to normal life without being prepared and being able to sort of stay ahead of the virus, we're going to risk ourselves a second surge. Now, the CDC has already stated there's a risk of a second surge coming in the winter. Even back when the H1N1 swine flu virus existed, there was a second surge during flu season in the wintertime. You can only imagine if COVID-19 had a second surge in the wintertime during flu season, how difficult that would be to manage. Remember, hospitals have already become very overwhelmed with this COVID-19. So if we're not prepared from a healthcare standpoint in terms of hospital capacity, in terms of protective personal equipment, remember that's a big limitation. There are doctors and nurses taking care of these patients that are not protected. That's why a lot of healthcare workers have gotten infected, okay? So all this has to be factored in. And ultimately, if we can get to the point where a vaccine is available and effective many, many months down the line, then that's sort of the final phase where people can get vaccinated and we can get back to a semblance of what life once was, okay? So again, stepwise fashion, that's the right way to do it.